Matthew Schulman, board certified plastic surgeon, and let's talk about male chest reduction. So let's start at the beginning. What do we mean by male chest reduction? We're talking about reducing the male chest. So it's very common for men to develop breast tissue. Their chest gets larger, and in some extreme cases, it can even look like they have small breasts. This is really common in teenagers. And as you can imagine, if you're a teenage boy and you develop enlargement of your chest where it looks like small breasts, that can be a big deal. It can affect your self-esteem. It can affect your interpersonal relationships. People can make fun of you. There's a whole snowball effect. So if a teenage boy or an adult male has chest enlargement, we want to talk about ways to reduce it so that they can look better and feel better about themselves. As I said, it's really common. It tends to develop during puberty. So, young boys, 11, 12 years old will have enlargement of their chest. And in most cases, they sort of outgrow it. As they get through puberty, their chest shrinks down a little bit and kind of normalizes. But in many cases, it doesn't. So they're left with this. It's usually due to just genetics. It's just the way your body's programmed. But in some cases, it can be the result of prescription medications. We see this in medications that are used for seizures or for psychiatric disorders or for hair loss. These medications have been shown to cause chest enlargement in men. It can also happen as a result of recreational drug use. So marijuana has been shown to increase breast tissue in males. Weight changes can do this. If you gain a lot of weight, your chest gets bigger because the rest of your body gets bigger, and then you lose weight, sometimes your chest doesn't shrink, so you're left with this extra mass or extra volume on your chest. And in extremely rare cases, male chest enlargement can be associated with a tumor. So if you have male chest enlargement or you develop excess breast tissue, you should definitely be seen by your regular doctor. Most likely it's completely benign, it's nothing to worry about, but you want to make sure that it's not due to some sort of underlying medical condition. So what do? Basically, we make the chest smaller, and how we do that will depend on exactly what the issue is. If you have excess fat in the area, a lot of times we can just perform liposuction. So I can do liposuction on your chest, just like we would on your belly or your love handles, and I can suck out the excess fat. Your skin of your chest will shrink down so you can get a really nice result. Sometimes the enlargement is due to actual breast tissue. As you may or may not know, breast tissue is much more dense than fat. It's a little bit more fibrotic, it's a little bit more rubbery, which means we can't just get rid of it with normal liposuction. It just doesn't suck out the way fat does. If that is the case, then we have to make a small incision, usually a little incision around the edge of the areola, and I will actually pluck out that breast tissue. So that's another way to treat this. And then thirdly, if your issue is excess skin, which is seen more commonly if your chest is the result of your weight gain and weight loss. If the skin is stretched out, then we have to remove the skin. This is done by actually cutting out the skin, sometimes moving the nipple, sometimes not, depending on what you need. And it's really common to do a combination of all three of these procedures in a male chest reduction surgery. So maybe I have to do some liposuction, plus remove a little gland, plus remove a little skin. These are the things we'll figure out when you come to see me. I'll examine you and I'll let you know exactly what type of procedure I need to do in order to reduce your chest. And that will tell you the scars that you're gonna have and also your recovery. No matter what technique I'm gonna use, it's probably gonna be done in my operating room. So I have a fully certified accredited operating room right here. It's a completely certified OR. We meet all sorts of national standards. You will be completely asleep. I will have you monitored from start to finish by a board certified anesthesiologist, so you're going to be very safe. After the surgery, you'll end up in my recovery room. You'll probably spend about an hour and a half, maybe 2 hours in the recovery room until you feel okay, and then you can go home. The amount of recovery you need afterwards will again depend on exactly what I need to do during the surgery. If it's just liposuction, you can be back to normal activities within a few days. If something more extensive needs to be done, like remove some skin, then maybe it'll take you a week or two. And again, we'll discuss this during your consultation, so there won't be any surprises in terms of the pain and the pain that you have and the recovery that you need. Will the breast tissue come back? Will your chest get bigger after the surgery? Usually not. When the surgery is done and the fat is removed or the gland is removed, usually the results will last forever. Remember, the aging process still continues. So your body will still age and your body will change as you age. So it's very possible that you may get a little looseness of your chest as you get older, because that just happens normally. But the surgery we do won't just stop working. Now, the one thing I should tell you is that if your chest enlargement is due to a medical condition or medications or drugs, and you continue with those same things, then the chest tissue may regrow. So that's something to consider. Hopefully this answered a lot of your questions about male chest reduction. So if you have concerns about the way your chest looks, you want to come see me, set that up, you know how to do that, and I'll examine you and we'll talk about what your options are to make you look better and feel better.